So at Kingsbridge, we've always tried to deliver world-class care, be that across all of the specialties we do. But today in orthopaedics, I'm delighted to say that while we used to 3 or 4 years ago offer patients to stay 2, 3 and sometimes even 4 nights, we've managed to reduce that down to just 1 overnight stay, and in some cases patients will go home the same day. That's not just about patients leaving early, that's about patients having a better clinical outcome by being in for surgery and back home as soon as possible.
Well, I'm actually retired from work, and I found myself not being able to go for walks and do my garden and things like that, and it come to the stage where on the NHS waiting list it was on a never basis, so we decided to come to Kingsbridge to get it done privately, and to our surprise we got it done in Kingsbridge inside a month.
The enhanced recovery pathway optimises the patient journey. It means they are able to get up earlier after their operation. This reduces risk of complications, mainly clots in the leg or the lung. It reduces infection. Outcomes overall are better, and the patient gets to the comfort of their own home quicker.
So how do you feel now after the operation?
Oh, I feel very good. I'm 5 or 6 hours over the operation and I'm already up and walking about on my helper here, and I feel good. If I was going to have to wait on the NHS, it would have been between 5 and 6 years to get the operation.